you can help us fight the good fight. And not only that, you will get 2 stickers, the End Medical Debt official logo sticker and our Medicare for All sticker. And if you're already a member, thank you so much. You can get the sticker for any donation of $5 or more. The link is in the chat. And with that, let's get started with tonight's town hall. Our first guest is Bernita Haynes. She is a staff attorney with the National Consumer Law Center, and she focuses on the crisis of medical debt in our country. In particular, her research is focused on how medical debt disproportionately affects low-income folks and people of color in specific geographic regions like the South. If you have questions for Bernita, please put them in the question and answer section, and we'll research you've done on this issue.
Yes, thank you for having me here. Recently, I actually wrote and published a paper called The Racial Health and Wealth Gap, the impact of medical debt on Black families, looking specifically at how medical debt disparately impacts Black families, especially those of us in the South. And it's really stark. 1 in 3 Black adults have past due medical bills, compared to fewer than 1 in 4 white adults. 17% of Black adults lack health insurance compared to 12% of white adults. So these are some pretty stark contrast in terms of who has medical debt, despite the fact that medical debt is sweeping. It affects everyone. Certain groups are more impacted. Some of the things that are really strongly correlated with medical debt, with having medical debt, are chronic conditions and health risks like cancer, infant and maternal mortality, heart disease. All of these things actually disparately impact Black families. The more you have chronic conditions, the more likely you are to be interfacing with the healthcare system frequently, which leads to more medical bills. Lack of health insurance is also strongly correlated with medical debt. And many Black folks are concentrated, the majority of Black folks are concentrated in the South, the states that did not expand Medicaid generally, although a couple have made some changes lately. And so what we see is a high uninsured rate among Black folks, which means more likely to have medical debt. You compound that with lack of wealth to actually deal with the medical bills when they arrive, and you can see it creates sort of a vicious cycle of debt and poverty for folks. As Joseph mentioned, medical debt is much more acute in the South, particularly because we are a region that did not expand Medicaid. And that lack of insurance issue is really a key part of the medical debt crisis. I do want to emphasize, though, that there are some things that states and the federal government in particular could be doing. States have actually been doing more on the medical debt front than the federal government. But Joseph pointed out, there are 3 particular things that the federal government can be working on right now. Ending price gouging. The President of Congress can condition Medicare and other taxpayer funding on hospitals capping charges at the Medicare and Medicaid rates. Guaranteeing the right to free care. Conditioning, in other words, Medicare and other taxpayer funding on hospitals' provision of financial assistance, setting very specific financial assistance requirements. The ACA currently doesn't have very specific financial assistance requirements, which means there's sort of a no man's land in terms of whether or not you'll qualify for financial assistance at this hospital versus that one. You may qualify for financial assistance in Maryland and then come to a hospital in Georgia and not qualify, very likely actually. Because the states that didn't expand Medicaid is where you find some of the stricter eligibility requirements for financial assistance at hospitals. But also stopping predatory collections. The President and Congress can condition Medicare and other taxpayer funding on hospitals committing to end predatory collection practices. It's already been mentioned, some of the practices we've seen, but we're talking wage garnishment, seizure of bank accounts, body attachments, in other words, civil arrest warrants for those who fail to show up in court when they've been sued on a medical debt, liens on homes. Now, as I mentioned, some states have started taking steps to actually remedy this problem and reduce this problem for a lot of patients. New York has outlawed property liens on homes for medical debts. Maryland is working on legislation at this moment to make sure that debt collectors cannot put people in jail for failing to show up at court when they've been sued. So no civil arrest warrants. The federal government, however, has been slow to make some changes to improve the ACA, for instance, and to just do some of these three things that we've been mentioning here in terms of price gouging and improving financial assistance and so forth. One of the quickest ways to improve financial assistance is to require screening, proactive screening. So that pile of papers we always fill out when we go to the doctor's office, why not just slip a document in there that allows the doctor to determine if a person would be eligible for financial assistance? That way a person's never slapped with the bill in the first place, right? But we don't do that so far. Only one, well, not only one state, but only a few states have actually made that the law of the land. Many people end up with medical debt because they literally that financial assistance was available. So pre-screening would be a really key change. And I'll stop there because I know there's so much more that I can say, but I don't want to go over time. And I know, Joe, you probably have a couple of questions for me, so please jump in.
So, Bernita, let me ask you this. You've done some research and looked at hospitals and their charity, nonprofit hospitals in particular, and their obligation to provide charity care or free care in exchange for receiving tax breaks from the federal government as well as from local jurisdictions. Tell us a little bit about what you and others have found. Are hospitals living up to their duty to provide this care?
They are absolutely not. First of all, hospitals are never generally informing folks of their eligibility for charity care. That's a huge problem. A reporter that I know recently did an in-depth investigation on the Mayo Clinic, I believe it was, and found that they were not properly informing folks. But on top of that, hospitals simply are just not spending much on charity care. In 2017, for instance, hospitals spent $14.2 billion on financial assistance. That sounds like a lot, but you got to wait for it. They spent $14.2 billion on financial assistance, right? While generating $47.9 billion in net income. Overall, spending on charity care accounts for about 2% to 4% of expenses at private tax-exempt nonprofit hospitals. We will see patients at some of the nation's top hospitals, as Johns Hopkins reported in a recent report, billing patients and hounding patients for like $1,800 of a medical debt. Meanwhile, those hospitals are raking in billions. Meanwhile, they're spending only 1%, 2%, maybe 4% at best on charity care, literally sending people into a spiral of debt over just $1,800, for instance. So hospitals are absolutely not doing enough. They're not informing patients about charity care, and they're certainly not spending enough on charity care. The last thing I'll say is we also see hospitals, after they've hounded someone, writing off the debt as a bad debt, which then can be used as part of their charity care requirement. And you can already kind of hear how bad that sounds. You've hounded a person for $900, $5,000 maybe, and then you decide they can't pay it. And so you write it off as a bad debt, which counts as charity care. So you're able to say that you provided charity care, but you really haven't because you've ruined a person's credit history and maybe their ability to get housing or a job or so forth. So hospitals are definitely asleep at the wheel, to put it lightly, in terms of charity care.
Well, and what I think is interesting, Bernita, is, Robin, who's one of our audience, put a question in the chat. How can we afford these solutions to medical debt? Well, the truth is we, the people, taxpayers, are already providing hospitals with the money, right, in the form of tax breaks, right? They don't have to pay federal taxes. Many hospitals don't have to pay for water or sewer or police services or fire services because we, the people, say in exchange for not paying taxes, you got to serve the least of these. In addition to that, we give hospital billions and billions of dollars in Medicare and Medicaid, which is the majority of hospital revenue. Without taxpayer dollars, most hospitals wouldn't be making the type of bank that they are making. And hospitals are making bank, as Bernita's pointed out. Bernita, another question I want to ask you. Hospitals can afford this. The industry can afford this. What moves have we seen? You've referred to some activity at the state level, at state levels, at city levels. What action have we seen at the federal level on the crisis of medical debt?
Yeah, there's been a lot of conversation at the federal level around medical debt, which is great. That is important momentum to keep up, and it's very important for us to take the opportunity that this moment presents. We did see the No Surprises Act, for instance, go into effect in January of last year. That is supposed to prevent surprise medical bills, which used to be a main source of medical debt. The big three credit bureaus also made some major changes to how medical debt gets reported on credit reports, removing medical debt less than $500 that's unpaid, and also waiting a full year before adding any new unpaid medical debt. There were some VA changes that were announced regarding how medical debt gets reported to credit bureaus. So there have been some changes, and there's been a smorgasbord of reports that have come out from the CFPB in particular about the impacts of medical debt and so forth. But there needs to be so much more work done to make some of these changes more tangible. Biden issued an executive order that was really focused on strengthening access to quality, affordable healthcare, but the tangibles aren't quite there. Vice President Harris also made an announcement back in April about how to make healthcare more affordable, and literally directed the Department of Health and Human Services to evaluate billing practices. But there needs to be more tangibles before we can really call anything that the federal government has done on this issue a win.
That's right, Bernita. I think the executive orders and the action that have been taken so far really focus, I would say, on some of the symptoms, but they don't get to the root causes themselves. You have executive orders say, well, let's address the credit, make sure people's credit isn't ruined by medical debt, but it doesn't address the medical debt problem in the first place. And that is our goal, right? We don't want the Department of Health and Human Services and other cabinet agencies just to study the problem of medical debt. We want HHS to say, tell us how we can stop it. And that's what this campaign is going to be about. So Bernita Haynes with the National Consumer Law Center, thank you so much for joining us. If there are other questions for Bernita, please put them in the chat. We will try to answer them later or get them to Bernita so she can answer them after the call. So with that, I want to invite everyone here to join us in this fight. Here's what it's going to take. It's going to take thousands of us, right, standing up to the most powerful people on earth, the president, members of Congress, and demanding that they take action. It's going to take thousands of us standing up to the powerful healthcare lobby and saying enough is enough. And I want to invite all of you, and in particular people who have medical debt stories, to get involved on our Freedom from Medical Debt organizing team. We've already been meeting with members of Congress. We've already been consulting them on legislation and executive action, and we are going to be ramping up our campaign. And we've got to make sure that we have people from coast to coast in every congressional district involved in this fight. So I urge you, join our Freedom from Medical Debt organizing team. The link is in the chat. Now I want to bring up some of the Our Revolution members and activists who have struggled firsthand with the crisis of medical debt. As I've said, many of them have already done meetings with members of Congress, with the staff of Ro Khanna, with the staffs of Bernie Sanders and others. And they are to be commended for standing up, overcoming fear, overcoming any personal shame, and realizing this is not my personal fault. This is a public problem that needs to be addressed. So I want to shout out to all of our patient advocates who are telling the stories. And in particular, I want to bring up and commend Kristen Noreen, who's joining us from Washington State. Like many Americans, Kristen ended up a visit in the hospital, ended up with her declaring bankruptcy. Kristen, thank you so much for joining tonight. Tell us a little bit about your story and why you're involved in this fight.
Hi, thank you for the opportunity to tell my story. I'm 59 and I live in Bellingham, Washington. In 2009, I had a $70,000 a year job with full benefits. I was downsized in June that year. I continued working as a self-employed contractor, and I was on a $600 a month COBRA plan in 2010 when I was hit by a car on my bike. I was in the ICU for a week, in the hospital for 2 months, and I had 8 months of outpatient rehab after that. I had 15 fractures, an amputated hand that was successfully reattached, heavy organ damage, and a traumatic brain injury. My hospital charges were over $1 million. Auto and health insurance covered all but $60,000. I got a charitable grant for $50,000 and I had to cover $10,000 on my own. Ongoing follow-up care is barely covered under my Affordable Care Act plan, and I keep racking up more debt. I reached $60,000 at one point and had to file for bankruptcy. I'm back up to $10,000 on credit cards, and as of last month, I have another $3,000 in debt to the IRS for prioritizing my care over my estimated taxes. I've been denied disability, and I work part-time from home as much as I'm able to. I have little incentive to do better because when I make more money, I have to pay back my Affordable Care Act subsidy up to $800 per month rather than pay off my debts. At one time, I qualified for Medicaid, but they weren't able to provide the level of care I need. I was actually banned from my orthopedic surgeon's practice over a $125 bill. I can't make as much money as I need to live month to month with my health issues, but I refuse to simply give up and stop getting the care I need in order to function my best. I've already sold my home, my car is 17 years old, and my retirement account is gone. My parents took out a home equity loan in order to help, and my medical debt has ruined my whole family. When I was lying in the hospital on a respirator, I assumed, like any American would, that I would at least be set for life. If I'd known how it was going to be, I might have given up. I'm glad I didn't, but there's no end in sight for this debt cycle. And this is Kai.
Hi, Kristen. Hi. So, Kristen, tell us a little bit about, this has been obviously a traumatic series of experiences that you've been dealing with for over a decade. That being said, it doesn't seem like it's something that's one and done. It doesn't seem like something has passed. As an incident, a horror story that passed, tell me a little bit and tell our listeners how medical debt has impacted your ability to get ongoing care, to get your, care for, maintenance as well as pain management.
Well, I'm still on pain medication to this day. And the three things that help the most in controlling my pain are chiropractic adjustments, massage, and acupuncture. And those things are just barely covered by insurance. Chiropractic is covered a little bit, but massage and acupuncture, not at all. So if I could get as much of those modalities as I need, I could live without the pain medication, but I'm stuck with it. I'm also not able to work as much as I would like to because my pain increases as I spend more time at the computer. So, and then when I make more money, I have to pay back my ACA subsidy rather than pay off my debts. So, that makes my taxes go up at the end of the year because I have to pay back the subsidy as part of that.
This is an outrageous and vicious cycle. So, Kristen, what do you want? If you could talk to President Biden, if you could talk to leaders in Congress, what would you tell them?
I would tell them that that patients can't get better when they're saddled with this debt. That it's a permanent impact to our health, and that charges to patients just can't be that high. That but I'm sorry, I'm blanking.
No, that's right, Kristen. It is the point that you're bringing out, I think, is a really critical point, which is medical debt isn't just an economic problem for folks. It is actually a problem that has real tangible health impacts. It is a social determinant of healthcare outcomes. And why is that significant? I would say it's significant because we, the people, as taxpayers, fund we fund Medicare, we fund Medicaid because we want to make sure that people have good health outcomes, not get started on healthcare and then end up with medical debt that forces them into deeper and deeper suffering. And so, the truth is, if we want to fully lean in to why we have federal subsidies going to these hospitals, it's about the health and welfare of the American people. And in order to address that, we need to make sure that hospitals that are funded by taxpayers, that receive lucrative tax breaks, aren't forcing people to make decisions about how they allocate scarce resources. Do I pay for food? Do I pay my tax bill? Do I get the pain medication I need? Kristen, thank you very much for joining us. And thank you, Kai, as well, for joining us.
Thank you.
So with that, I want to encourage everyone, if you're on this call and you have a healthcare horror story, share it with us. It is these stories that are going to move policymakers to take action, because medical debt doesn't just drain bank accounts, it cuts people lives short because they're putting off care and treatment and medication. If you're one of the millions of people who's struggling with medical debt and you want your voice to be heard, your story to be told, and you want action to be taken, click on the link, tell us your story, and an organizer will follow up with you to get involved in our campaign. Link is in the chat. Now, I'm honored to bring up our next patient advocate. Her name is Denise Lyons. Denise is 70 years old, but cannot afford to retire. She's still working part-time as a nurse in order to cover her healthcare costs. She's been putting off getting necessary treatment in order to avoid incurring more medical debt. Denise, thank you for being here tonight. Tell us a little bit about your story and why you're involved.
Thank you. My name is Denise Lyons. I'm a nurse in Michigan, senior. Once I developed diabetes, I also developed a host of other symptoms that had to do with heart. My heart was heart racing. I was having symptoms of sinus infections frequently, profuse sweating. I was having a range of symptoms that affected 4 different specialists. As I started seeing each specialist, paying the copays for the specialists, in addition to the copays, then you have to do testing. For the cardiologist, it was 3 different tests. For the endocrinologist, it was 2 biopsies. For the sinus infections, it was a CAT scan. For the then that doesn't even include the dental. But as I started taking the tests, I started incurring debt. I took one ultrasound for one lump. I developed lumps on my body. Each lump, they wanted to do an ultrasound, $78 for each ultrasound, which has already gone to collections. The things that really helped me were the alternative things, similar to Kristen. the things that help with diabetes, moringa, spirulina, going to see herbalists, going to see nurse practitioners. Those are the things that help me, but I couldn't afford them. So I'm at the point now where I'm just at a standstill because I cannot afford to take on additional debt. And I'm not feeling quite well, but I'm well enough to at least continue working part-time. So I really don't have a solution for what's going on at this point in time, other than to get involved and continue to try, like Kristen, who I really, really admire for seeking treatment that would still help her. And I'm pretty much at a standstill right now, trying to make a decision about which way to go. The alternative therapies are really what help, but the insurance doesn't cover them. So there I am.
So Denise, like so many other people who don't know what to do, the truth is you do know what to do, which is you're standing up and you're saying enough is enough. And that's what it's going to take for us to address this issue, to make sure people are getting the treatment they need. You told me earlier you've got lumps on your body that you're not able to afford an ultrasound. That's outrageous. And we need to make sure that in this country, the richest country on earth, that nobody goes without the health care that they need. And what can we do about it? We can stand up and we can organize. So Denise, thank you so much for joining us and sharing your story.
Thank you.
So again, if you have a medical debt story and you want to be a part of that campaign, use the link in the chat to share your story with us. In addition, if you want to be involved in our campaign as an activist in our Freedom from Medical Debt organizing team, sign up and help us move this fight forward. Now I want to welcome Betsy McLaughlin to our call. Betsy is an Our Revolution activist from the great state of Indiana. She's been battling medical debt ever since 2015 when she went to the hospital for an injury. And she's since then been juggling that medical debt, passing it from credit card to credit card just to stay one step ahead of the bill collector. So Betsy, welcome to our call.
Thank you, Joseph. Everything that I have heard so far makes my problem seem small in comparison, seriously. What Bernita said is especially important, that interfacing with the healthcare system frequently leads to more medical debt. And that is exactly what Denise reinforced. Every time you go, it's going to cost you more money. So I think it's been drilled into all of us that it's bad to go to the doctor and we don't deserve it or something like that. So anyway, in 2015, I went into debt. I had an injury, and my portion of it, even though I was uninsured, didn't take any time off work, my part of it was about $4,000. A year later, I got sick, nothing I could do about it. I had several surgeries over the course of the year, took a couple weeks off here and there. And while I was taking a couple weeks off and getting the health care and paying the doctors and the anesthesiologists and the radiologists and all those people, I was paying for groceries and utilities with my credit cards. Because just like Kristen said she was banned from her orthopedist practice. That was the kind of fear that I had back in 2017. If they won't see me anymore, what am I going to do? Who's going to make sure that I'm okay? So I paid the medical people and the hospital people, and I did the groceries and utilities and stuff on credit cards. So I totally understand what they did, and I made a different kind of choice. But my story is the same in that there's no end in sight. I don't see how it's going to be better. Anytime that I get sick and I have to use my insurance and my own part of the deductible, whatever, I'm going to go farther into debt unless I win the lottery, and I don't play, you know.
And so, Betsy, tell us a little bit about why you decided to tell your story and get involved in our End Medical Debt campaign.
There's just so many things that I could say. I will tell you, and maybe it's too much, but my mom had multiple sclerosis. My folks divorced when I was 12, so that Medicaid would pay for my mom to have nursing home care. So my folks divorced when I was 12, and my mom lived in a nursing home just because there was no money to privately take care of 24-hour care for her. So since I was 12 years old, early teens, and until the time she died when I was 20, I was resentful of the healthcare system and felt as if it wasn't fair. And then I grew up, and gosh, other things have happened, and I still think it's not fair, but it's even worse now, you know?
And so this has been a core issue for you from the beginning.
Lifelong. Yeah.
Lifelong. You saw your parents struggle with paying for healthcare. You yourself struggled with paying for healthcare. So, Betsy, tell me a little bit, how much debt do you think you incurred total? And then how much of that is still on credit cards?
Oh, it's really hard to say how much total. There's the 4,000 here, the 5,000 there, the 7,000 there. And never mind the radiologists and all the small things that come through. Just as Denise was saying, everybody sends a bill. Anytime you touch a medical professional or they look at you, they're going to charge you something. There's no question about it. But the biggest thing for me has been the healthcare debt. I have been for the past, since 2017-ish, a couple of years after it began, I've been between 20 and 30 grand in credit card debt all the time. And I pass it from one card to another or loan to another. And in the meantime, I'm just grateful that I'm employed and insured and I can keep making the payments. And of course, I'm paying for my insurance through the ACOA, which is close to 25% of my income, which is ridiculous. But that's another story, right? It all goes down to one thing. Healthcare costs too much and we can't all get it.
Right. Right.
Thank you, Denise. Yeah.
And so, Betsy, do you think you'll ever get out from that, from the tens of thousands that you owe?
It happened if I live to be as old as my grandmother, who was 93. I'm 62 now. So we'll see. There's still hope.
Keep hope alive. Well, I think the best way you're keeping hope alive, Betsy, is by standing up and being a part of this campaign, speaking out, telling your story, because that's what it's going to take to move policymakers and to take action on this issue. Because despite the expansion of recent expansion of Medicaid, despite the Affordable Care Act, too many people are having their lives turned upside down by unaffordable health care that results in medical debt, that results in horror stories. So thank you for being involved. And I want to encourage everyone, again, who's on this call, tell us your story. If you have a healthcare horror story, or if you know someone who does have a healthcare story, tell us your story. We're collecting stories in every congressional district from coast to coast, because that's what it's going to take to move the president, move members of Congress. And if you want to get involved, you don't have medical debt, you can sign up for our Freedom from Medical Debt organizing team. We're going to be ramping up after this town hall to make sure that both action and legislative action to end the crisis of medical debt in this country. Now it's my honor to welcome our next guest, United States Representative Ro Khanna. Ro has been a longtime progressive ally in the United States House, and he's a partner with us on this campaign to end medical debt once and for all. As many of you know, he served as a co-chair of Bernie's 2020 campaign, and he is an active member of our revolution. If you have questions for Representative Khanna, please put them in the Q&A. Ro, appreciate you taking time out of your schedule to be here and listen to the stories that we've collected. Tell us a little bit about what you and your colleagues are thinking about in terms of solutions to address the problem of medical debt.
Well, first of all, Joseph, thank you. Thank you for your leadership going back to the early 2000s and fighting to end medical debt. The only sad thing is we still have medical debt that's growing, even though you've been leading this fight. And we have raised a lot of awareness, but we've now got to actually end the debt. And thank you to Betsy and all of the stories. I mean, it is so common to hear about people who have $20,000, $30,000, $40,000 of credit card debt. I mean, some where they're getting hundreds of thousands of dollars of bills, but many Americans where they're sitting with this debt, $20,000, $30,000, $40,000, never ending, paying the late interest fees on it, just because they broke a bone and went to the ER, or because they had emergency surgery, or because they had an unexpected medical procedure. This is just wrong. You should not go into debt because you fall sick. And I met about a year ago with a group in my office, March for Medicare for All, and Savage Joy, and they've got an organization in 60 different states. And someone brought a bill for probably about 1,000 pages. It was bigger than any book in my room of all the bills that she had. And it's just outrageous that we're allowing this to happen in the United States of America. And that's why Bernie Sanders and I are teaming up. We've been working for about 6 months, and it's in the final stages to be introduced of legislation. And Joseph, I know you've been very, very helpful in that process as well. And the legislation will say that we're going to end all medical debt, cancel it. If you have medical debt, it's erased to zero. Now, the hospitals need to wipe it out. And if they wipe it out, then there is some federal funding that can be available to them for doing the right thing. If they choose not to wipe it out, they have no choice. We will then cancel it. But the idea is just to eliminate this medical debt. It's something that hospitals are making way too much profit off, and we can provide some assistance for the hospitals who will do the right thing. The federal government can do that. It's affordable. And it is the right thing to do. And frankly, it's the first step. And then we need Medicare for all, so we don't have this continual debt piling up. But expect in the next couple months us to introduce it. And Joseph, what everyone here on the call is doing and sharing their stories is so important, because this is something that members of Congress across the country need to realize affects real people, is affecting their constituents, and they should sign on. Frankly, even if they don't agree on Medicare for all, they should at least sign on to the proposition that people pay $20,000, $30,000, $40,000 in debt.
And Representative, let me ask you this. So canceling medical debt is a core part of our policy agenda. It's being done around the country. Jurisdictions are states, cities, DC government, Cleveland recently are passing legislation to use American Rescue Act funds to wipe out medical debt. That being said, that is, that's an important fix, right? We want to wipe the slate clean. What do we got to do beyond Medicare for all? What do we have to do to make sure that even if Kristen's medical debt gets wiped out, or Denise's medical debt gets wiped out, or Betsy's medical debt gets wiped out, what do we got to do to make sure the system doesn't keep operating like it does? Because we do know, as one of our town hall folks said, it seems like every time I go see a healthcare provider, I get a bill, and it's pretty outrageous.
Well, the real solution to Kristen and Denise's issues are Medicare for all, because that would not have copays. You wouldn't have these outrageous premiums. Everyone would pay a fee, a small fee, to have national health insurance, and you wouldn't have these outrageous bills. But short of that, we've got to restrict the ability of the people to have outrageous bills, these hospitals. I mean, there's got to be a restriction on harassing, on collecting medical debt from individuals. We can say that, they can go after, I guess, the private insurance companies until we have private insurance companies, but they should not be allowed to go after the patient, the individual. But, that is a cosmetic, it's a cosmetic change, a Band-Aid solution. What we really need is a long-term solution, which is Medicare for all.
And Bernie, Representative Jayapal, you other members of the CPC are going to be rolling out Medicare for all next Monday. And then after that, legislation on ending medical debt, canceling medical debt. One of the things that I think is significant is that hospitals get billions of dollars from the U.S. government. Hospitals are federal contractors. They get billions of dollars. The majority of their revenue is from programs like Medicare and Medicaid. And the administration has used that funding authority to, do some regulation. Do you agree that the, companies, hospitals, whether for-profit, not-profit, that get federal funding should be held to a higher standard? They should not be able to price gouge patients and engage in these predatory collections practices?
Yes, and that's where I think the executive order comes in. I mean, you don't need even Congress for that. What you can have is the president signing legislation, signing an executive order that says if you get federal funding, you can't engage in price gouging. You can't engage in collections from the individual. You simply cannot go and put a debt collector on an individual or stick individuals with these bills, or we're going to stop the federal funding. We're going to stop your hospital from getting the federal funding. Now, our bill, Sanders and my bill, eliminates it completely, whether you're getting federal funding or not, and it actually allows hospitals to apply to a federal fund to make sure that they have the incentive to do it. So it's the cleanest way of doing it. But short of that, we can stop at least the most egregious practices with the leverage that we have with the federal funds. And that is why we've got to push the president to do it. And, as it turns out with a lot of things, Joseph, good policy that helps people turns out to be good politics. If you do things that help people's lives, if you make childcare free or childcare $10 a day, as I've been pushing, if you make it Medicare for all so that people have health care without premiums and without huge deductibles, if you help make college free or vocational education free, guess what? People tend to think that that's good politics because they see that this is something actually that's going to help my life. If the president says, I'm going to eliminate medical debt, think about the millions of Americans who he could help with a stroke of his pen. And if he says, I'm going to go push for that if I get reelected, think about all of the people whose lives he could change. I mean, imagine wiping out credit card bills, just like we're trying to wipe out student debt. Even more urgent, I would say, is wiping out medical debt.
That's right. And the truth is, I think this would be resonant with the American people generally, and with progressives in particular. But it would be resonant because with the American people generally, because medical debt, as we said earlier on this call, number one cause of personal bankruptcy in the United States. Even after we passed the ACA, it's outrageous. And the president the administration has the power to fix it. The administration's issued a couple of executive orders on medical debt, around credit reporting, around urging all the agencies of government to work together on medical debt. But at the end of the day, what we haven't gotten, and then what we are collectively pushing for, is making sure the president uses the power he has as a regulator and funder of the American healthcare industry, using that to police the worst behavior. The other thing, bro, that I just wanted to mention is not only are we bankrolling hospitals, right, with Medicare and Medicare dollars, we also give them tax breaks, right? We don't make them pay for federal profit, income taxes. They don't have to pay for local water, sewer, because there's an expectation that nonprofit hospitals use that money to provide care to the least of these. And what Bernita Haynes, who was on this call earlier from the National Consumer Law Center, told us was hospitals are spending maybe a fraction of the money that they're saving on tax breaks on free and charitable care. So either way, we're getting taken for a ride. We're bankrolling the hospital's bottom line. The majority of hospital revenue comes from Medicare, Medicaid dollars, and then they don't have to pay taxes. It's outrageous. It is a heavily subsidized and regulated industry that continues to screw the American people. So, Ro, want to thank you very much for your leadership on this issue. As I told the Hill this afternoon, I think healthcare is the third rail. It is an issue that presidents, from the time of Truman to Clinton to Obama have tried to address, but still millions of people are struggling with this issue. And it is long past time that we put an end to medical debt in this country. I want to thank you for your leadership on this campaign, Representative Khanna.
Well, thank you, Joseph. Thank you for what you're doing. And just to be clear, we're not trusting Joe Biden to do this. We're going to push, but Bernie Sanders and I are going to be introducing legislation to do this, just like we did, just like Bernie Sanders has for Medicare for All. And, I know Logan and some of the folks that March for Medicare for All want to make sure that we introduce this legislation, and that I know you, Joseph, are doing this organizing in every congressional district so we can get co-sponsors on the legislation and pass it. That's really what's going to change. And we need progressives running for Congress, running for Senate, eventually running for president, changing the platform, having the party adopt Medicare for all. But in the meantime, we've got to fight to make sure that we get whatever we can from the administration. And as you've pointed out so eloquently in the Hill article, they have power that they're not exercising. That we give tax breaks to hospitals, we give federal contracts to hospitals. They are obviously the recipients of the large Medicare and Medicaid spending. We can at least outlaw the most egregious behaviors and outlaw them harassing individuals with medical debt. And that will make some dent in the issue. So it's got to be a two-front war. We've got to pass the bill that Bernie Sanders and I are going to put out. We're going to organize around that bill. That has to be the North Star. At the same time, we've got to say to the administration, look, you won on the promise of many people on this call. It took all of us. All of the Bernie folks came out in a big way for President Biden, and we need to see some progress on student debt and medical debt.
That's right. United States Representative and our revolution, progressive ally and champion, Ro Khanna. Thank you for joining us, brother.
Thank you. Thank you, brother.
And so before people drop off this call, I want to again encourage you to share your story if you have it. The story, your personal story, is the most transformative thing that you can share to be a part of this campaign. I also want to urge all of you, if you are a sustaining donor already, thank you. One-time donation to support this campaign. We'll send you our official End Medical Debt sticker and our Medicare for All sticker. Or if you are not a recurring donor, if you're not a sustaining member of our revolution, invest in our movement, because you know what? It takes resources to do more than a press pop. It takes resources to do more than a town hall. It takes resources to run a long-term campaign that's going to change the lives of millions of people. I believe that we have a theory of winning. It's been used before. We can do it now, but we need your help. So become a recurring donor to our revolution and help fund our campaign to end medical debt and win Medicare for all. And by becoming a recurring donor, you will get these 2 amazing stickers. And I also want to invite each of you to join us for our next Monday night Organize to Win call. It's going to be not next Monday, but the Monday after. And we're going to be joined by our Revolution board member and Minnesota Attorney General Keith Ellison. Keith Ellison has a new book that's going to be coming out, and he's going to be about the criminal justice system and how what needs to be done to fix it. And he's going to talk to us about the book, which is going to be released the next day. So join us on that Monday call to get the insider story on Keith Ellison's new book. And with that, I want to thank everyone who's joined our call. I want to thank all of our patient advocates. I want to thank all of our organizers, our staff members who helped bring this together. And I want to thank our elected officials who are standing with us in this fight, because we know this. When we organize, and this is how we end all of our calls, when we organize,
we win.
Say it with me. When we organize,
we win.
When we organize,
we win.
We win.
We're going to win this campaign, brothers and sisters, with your help. Thank you and good night.